We are born in debt, owing the world a death. This is the shadow that darkens every cradle. Trauma is what happens when you catch a surprise glimpse of that darkness, the coming annihilation not only of the body and the mind, but also seemingly of the world. Trauma is the savagery of the universe made manifest within us, and it destroys not only the integrity of consciousness, the myth of self-mastery, and the experience of time, but also our ability to live peacefully with others, almost as if it were a virus, a pathogen content to do nothing besides replicate itself in the world, over and over, until only it remains.
Post-traumatic stress disorder is a mental health condition triggered by experiencing or seeing a terrifying event. The condition may last months or even years, with triggers that can bring back memories of the trauma accompanied by intense and emotional physical reactions. There are several accounts of PTSD tracing back to ancient times, where Greek soldiers were unable to speak or function properly on account of non-physical harm done by the experience of combat. There are also multiple playwrights, Sophocles and Aeschylus, who both wrote tragedies centered on soldiers who dealt with various psychological ramifications of war. World War I began as a clash of 20th century technology and 19th century tactics, with the inevitably large ensuing casualties. More modern technologies, such as heavy artillery, attributed to even more psychological distresses in soldiers during World War I. The impact of shells was believed to disrupt the brain and cause shell shock. Shell shock was characterized by the dazed, disoriented state many soldiers experienced during combat or shortly thereafter. However, even soldiers who were not exposed to exploding shells were experiencing similar symptoms. Thus, it was assumed that soldiers who experienced these symptoms were cowardly and weak. Compared to previous wars, World War II was a greater horror for the 800,000 men in extended combat. 1 in 4 World War II casualties was caused by combat fatigue. For those in lengthy, intense fighting, the ratio was 1 in 2. The leaders no longer thought combat fatigue was evidence of cowardice or a pre-war neurosis. It was a wound, albeit an emotional wound. PTSD as a clinical diagnosis has evolved in large part from Vietnam veterans. Disapproval of the war from American citizens was an important environmental factor accounting for veterans' post-war stress. Prior to this time period, veterans coming back from war were viewed as heroes. However, Vietnam veterans came back home viewed as murderers. Normally, these war heroes were encouraged to talk about their war experiences, but in this case, they were not and were shunned by a lot of the community. The term post-Vietnam syndrome was used to describe returning soldiers with trauma symptoms. This syndrome usually consists of combat-related nightmares, anxiety, anger, depression, alcohol or drug dependence, and poor responsiveness. The term post-traumatic stress disorder was not used in the Diagnostic and Statistical Manual of Mental Disorders until the third edition was published in 1980 under anxiety disorders. Females in the military, especially nurses, were exposed to highly traumatic events. Being responsible for saving the lives of soldiers coming from combat is extremely stressful and can take a toll on one's mental well-being. Almost 10% of females were diagnosed with PTSD 14 to 22 years after their service. Much has changed since America's involvement in the Vietnam War. Technological improvements have changed everything associated with war, including PTSD. These technological improvements, such as unmanned aerial vehicles, have allowed us to reduce the risk of danger to our soldiers. Yet even with this new technology, PTSD continues to be a prevalent condition seen in our military. Along with the obvious changes in warfare, it is important to realize how the world at home views the conflict. In World War II, the public fully backed the war effort. Following the Japanese attack on Pearl Harbor, it would have been hard to find someone who didn't support going to war. Vietnam is the complete reversal of the spirit that was present during World War II. Today, the conflict is more complex. The overall support for the war fell dramatically as time went by after the events of September 11th. But the public never treated the veterans of the current conflicts in the Middle East as they did with the returning ones from Vietnam. The troops are mostly supported fully and are treated as heroes upon their return, even if the conflicts are not supported. Many people think about PTSD in the context of military combat and war veterans. However, PTSD symptoms can develop from experiences involving natural disasters, serious accidents, life-threatening illnesses, physical abuse, and sexual assault during childhood or adulthood. 70% of adults in the U.S. have experienced some type of traumatic event at least once in their lives. This equates to approximately 223 million people. Up to 20% of these people go on to develop PTSD. As of today, that equates to approximately 45 million people who were or are struggling with PTSD. Today, there are multiple treatments available for PTSD. When you have PTSD, dealing with the past can be hard. Instead of telling others how you feel, you may keep your feelings bottled up, but talking with a therapist can help a patient become better. Cognitive behavioral therapy is one type of counseling. Research shows it is the most effective type of counseling for PTSD. There is a similar kind of therapy called eye movement desensitization and reprocessing that is used for PTSD. Also, medications have been shown to be effective. A type of drug known as a selective serotonin reuptake inhibitor, which is used for depression, is effective for PTSD. PTSD is a very common disorder and has affected millions of people over hundreds of years. It not only affects a person's brain, but the people that surround them. With proper treatment, this disorder can be beaten, and millions of people can return to living a normal life.